Welcome into the Hear Me, See Me podcast. I'm your host, Melissa Bruner, and we have a very special edition today because we are marking 100 years of the Menninger Clinic. The famed psychiatric clinic was started in Topeka, Kansas 100 years ago. They now are based out of Houston, Texas, but they maintain their Kansas connections. And this was a very groundbreaking clinic, a groundbreaking family. If you've ever studied psychiatry or psychology, you have probably heard of them. So we are honored to have with us today Dr. Walt Menninger, former CEO, also grandson and son and nephew of clinic founder, and the current CEO, Armando Colombo, who is out of Houston, Texas, where the Menninger Clinic is now affiliated with the Baylor College of Medicine. So welcome to both of you. It's an honor to have you both here, because when we talk about mental health and mental health awareness, Dr. Walt, I know you're very humble about this, but your family did play a very important role. What was the approach that you all took when you started the Menninger Clinic 100 years ago?
What was most unusual at a time when you did not have specific medications, they had some general sedations they could give, but in terms of a significant treatment plan was a matter of getting an understanding of the patient by a careful evaluation and history and so forth, and then trying to identify where were the challenges and how that person was able to function in groups and with others, and organize the entire treatment team, the doctor, the nurses, psychologists, social workers, the activity therapists, the groundskeepers even sort of got involved, but that would be a team that could have an understanding of what you needed to do to help the patient better cope with the frustrations or help in their coping styles that were compromised by either distortions in understanding or the like.
Was it easy for people to get treatment back in the 1920s and 30s we're talking about when the Menninger Clinic started?
Well, there were not a lot of places they could go. In 1935, 36, there was an article in Fortune magazine about private psychiatric sanitariums, and they wrote about the Menninger Clinic, Menninger Sanitarium, with 3 other major significant mental hospitals that were all on the East Coast in that area. There were not a lot of sanitariums that would take people and be able to put together a treatment plan that helped them go. And it established a reputation also because of the writings of Dr. Carl, my uncle, who is the oldest son of Dr. CF, who was a general practitioner. But Carl wrote a book called The Human Mind, and then followed it by Man Against Himself and Love Against Hate. And he had a lot of popular recognition. That is, there were a lot of people who got the book. And that brought, I think, the Menninger name into national recognition. He wrote a column in Ladies' Home Journal and so forth. And then, because of the character of the way they treated patients, they became recognized all over the country. And they started a medical psychiatric journal that still is continued, published. Now the editors are down involved with the Baylor College of Medicine. But it got recognized in the field as well as got the general popular recognition.
That concept of treating the whole person, Armando, today we think, well, of course, why wouldn't you treat the whole person? But it really was quite revolutionary if you think about the history of psychiatry, psychology. We didn't really, back in 1925, I'm thinking people weren't even talking about this. It was just, somebody went away, and we didn't even acknowledge that this was mental illness. How much do you honor this approach that the Menninger family started with, even though now you're in a much more urban environment than 100 years ago?
And so even though we're in Houston, Texas, we sit on 50 acres. The campus was designed very specifically around peaceful, outdoor spaces, we have walking trails, we have a labyrinth, we have every unit has outdoor space, an atrium where patients can have space outside. Every room has a window. Every patient's room is private. Their bathrooms are private. Very respectful to the whole person. And our teams are built exactly how they were built here. We have psychiatrists, psychologists, social workers, therapists, those that do testing, those that interpret testing, and it's milieu driven, so the patients are all together learning from each other. But I think the biggest key that makes us different than other places, in addition to the multidisciplinary team, is the involvement of the patient. It's not just, here, take these meds and you'll be fine. It's really involving the patient in their plan and getting to know what's the patient's goals. So many times people are admitted to a hospital and it's, I'm in charge of your care, I'm going to tell you what's going to happen. And it doesn't feel good, right? No. It doesn't feel good, but you feel much better when your doctor says, how are you? And where are we trying to get to? And how can I help you get there? And so by involving the patient and the team, we find that it's much more successful.
That's the name of our whole podcast,
Yes.
Hear Me, See Me.
Yes.
Someone wants to feel seen, they want to
Yeah.
feel heard. That nature connection is interesting because as you're saying it, I'm thinking, well, I guess there's a reason why they call people fire people, earth people, water
Yeah.
people. It all is connected to nature. How do you see that really helping someone connect with themselves when they have a place to be peaceful instead of they're sitting inside staring at four walls?
Yeah, so like a big part of our treatment in Houston is nutrition, activities. So we have a gym, we have a pool, we have every patient and client eats in a dining room, not in their room or on the unit.
It's the best place to eat in Houston. It really is. When I go down there, the chef and the staff and the food service are magnificent.
It is pretty amazing. But we also have designed additional levels of care to get patients out, right? And so the traditional psychiatric hospital of today is you're in a locked unit for 5 to 7 days, and then you're discharged to an outpatient center. And we find that patients need more time in treatment, but the time doesn't all have to be inpatient. So we've created residential program. We've created community integration programs that can move the patient through those different levels, but allow them to be outside of the walls of the hospital. So our residential program, for example, we go on outings. We take patients out into the community so then they can come back and talk about that experience and how they were able to manage that. Whereas many other facilities, you're discharged on Monday and they say, good luck. And so we're really trying to extend that connection with us and their community to help them all around fresh air, nature, being outside, and the whole person.
With a nod back to the history, there was a gardening, you had gardening
Yes.
programs and things on the original Menninger campus.
Yes, the patients would be involved in various kinds of activities, outdoor and indoor. I mean, with ceramics and painting, as well as gardening and sawing wood. The continuity of care is important, and they have really developed that and continuing to expand that in Houston. In Topeka, of course, people used to occasionally be aware that Menninger patients would be at a certain point where they would go out and actually work in the community. And even some of the people with reputations in another field who would get an activity working in a dress shop or some other.
Was there pushback on that? People hearing that, oh, this person that was in the psychiatric hospital is in the community. Was there a lot of pushback at your time when people heard that was happening?
Not that I'm aware of.
Which is actually kind of refreshing.
People accepted and realized that patients are people. I mean,
I think we can reflect that Topeka and the Menninger Clinic were really trendsetters and starting to break down the stigma about psychiatric illness in patients, because they were so embedded in the community here. And we're really trying to duplicate some of that in Houston now. When we first moved to Houston, we could only take the inpatient setting, obviously, because we can't move buildings and different programs. But over the years, we've now expanded and trying to duplicate, in my mind, many of the community integration programs and impact on our community that was here in Topeka. So we're kind of turning the clock back, so to speak. And I know that Walt's late brother Roy, who was part of our board up until his passing recently, was very pleased that we were bringing some of that spirit of Topeka to Houston, and I'm very proud of that.
One other thing, Dr. Walt, that you specifically looked into was the impact of trauma on mental health. And we talked about this when you were on the podcast. You were one of my first podcast guests here almost a year ago now. And we talked about that and your work that showed that, everybody has highs and lows, but if you have repeated traumas or repeated experiences that you never get to climb back out, it keeps kind of pushing you back down. How much do you see that still today and that approach? I forget, you have a specific name for it. I can't remember what it is off the top of my head, but how much do you see that today still when you think about the mental health in a lot of the young people that you encounter?
Well, I think when one has traumatic experience, it is a challenge to adjust and reset oneself in terms of going forward and coping. But I don't have a simple answer to your question.
Well, and the reason I ask is because I'm wondering, especially there's so much focus on trauma-informed care today, Armando, when you think about what your practitioners are seeing, do you see more of that today, that acknowledgement and using that as kind of a grounding point to move people forward?
We do, and our practitioners and therapists are very focused on that because, I'll be honest, especially since the pandemic, we've seen dramatic changes in our youth, and I always say that the phone calls I get are when the house is on fire and people need my help right away, and we take care of that. But wouldn't it be great if we could rewind the clock and help our youth earlier, so that they don't become adults or older youth with challenges that have never been addressed? So we're really trying to focus on the early interventions and screenings and testing to try to help those kids and adolescents get the treatment they need and conversations with folks early on.
There's also in Houston, they have now developed quite a solid continuum of care, so that it used to be primarily have people just in the hospital, but now they've developed a number of programs with people connected with the community who still maintain connection with the hospital, and that's so you can have a continuity of care. And they even have programs where staff will actually be able to go into a person's home and work with them. One of the programs of helping women who have depression after a birth, postpartum depression, and struggle as they have a newborn and how to take care of them. And they have staff from Menninger who will be assigned and be able to go out and basically help them cope with all the new problems they have when they unrealistic to assume they'll have to go to a hospital and so forth.
Well, there's a lot of history in Topeka, and that history then shifted to start growing those roots, is what you're talking about in Houston when the move happened in 2003. I want to take a moment to look about the future and hear about what's next, and we're going to do that in just a moment. We are back with Dr. Walt Menninger, former CEO of the Menninger Clinic, and Armando Colombo, the current CEO and president of the Menninger Clinic, now based in Houston, Texas, originally founded 100 years ago in Topeka. We talked about the history, but I am interested in the future because, Armando, when you were talking about the approach, what Dr. Walt outlined in the past with this holistic, whole person approach, and in Houston, why you take the approach you do, you mentioned it's because you realize people need more time. As much and as far as we've come, the approach that you've always been able to take, time seems to be a barrier. We constantly hear that the insurance company will pay for 30 days, for eating disorder treatment. They'll pay for 30 days for this. We'll give you 6 sessions for this. How do you overcome that?
That's a great question. So it's a challenge every day for me. When we first came to Houston, we didn't even take insurance because we wanted to see if we could prove the concept. And now since I've been there in the last 6 years, we're in network with many insurance companies, and it is a challenge. So we've created hybrid programs so patients can utilize their insurance for part of the stay and then utilize other funds for the other piece of their stay. But we have a very great group of philanthropists and fundraisers that help us offset some of those funds. And obviously we conduct research studies that we get NIH grants for and other foundation grants. So it's a combination of all of those things, the insurance dollars, the philanthropic dollars, and our research dollars.
How do you get people to buy into it and overcome the stigma? And even just when it comes to a person, me, myself, and I admitting that I could use some help, loved ones saying it's okay for you to get help, and the public at large saying, well, yes, we feel mental health's important, but I don't know yet if I can afford to support it. I'm going to put my money here because I can see food go on the table, but I can't see your mind mending.
I think when they see and get familiar with Menninger and that we're not a frightening place and that we are welcoming, we treat folks with empathy and respect, and there's a variety of choices. So you don't have to be an inpatient at Menninger. We have many outpatient programs. We have intensive outpatient programs. We have partial hospitalization programs where you can just come and see a physician and have a conversation. We're very open to options. I think the key is for us, we want to meet the patient where they are. And so if we need to meet them in their home, we can do that. If they need to be in a community integration program where they live in an apartment and program with us during the day, we can do that too. Or if they just need a televisit with a doctor to touch base about, hey, I'm struggling with this addiction issue, I don't know where to start, we can do that too.
Can you put a timetable on healing the mind, Dr. Walt?
Can you put it?
A timetable on healing the mind?
Not really, as much as we've tried. I mean, some can adjust to the time. We had, when we didn't have all of the constraints of getting the payment, in the last years that we were in Topeka, in the hospital, we had a number of patients who stayed for 3 months and left. We had some who stayed as long as 9 months. Insurance companies didn't tolerate that, and that's been one of the challenges. But the other thing is that one other asset is a recognition that mental illness affects everybody, the wealthy as well as the poor. And a number of people with substantial means or families of means who have offspring or find they can get help. They're in a position to then supplement, and Menninger counts on getting contributions from many people. It's an approved philanthropic institution that you can give to. And so there's a very important part of the funds that are needed to take care of mentally ill. Menninger doesn't just treat the rich, but it is able to treat many people more because some of the rich are very generous.
What is the future in the few minutes we have left here? What is the future of mental health in America? And you can address that whether it be what's the biggest challenge or what's the biggest hope that you see. Because you mentioned it, the pandemic really made everybody feel like we're a nation that's broken. And I don't think we're a nation that's broken per se, but we sure are a nation that realizes we need each other and we need connection and we need help.
You want to
sometimes.
Go ahead.
Well, we're always going to have the challenge. And I think a continuing challenge is then education and helping people. How can you better understand ourselves, that we do have anxieties? It's normal to get depressed when some things go wrong. And how do we build the resources in the community that are available, and the institutions around us that can help us better cope with new situations.
Well said. How about for you?
I think the Menninger Clinic continuing to be a thought leader and developing cutting-edge treatments to help people. You know, it's not like you break your arm and we put a cast on it and you're good. This is a lifelong challenge for many people, and continuing to deliver them the tools and the skills and the community support that they need to continue to become functional and feel good about what they're contributing to their society, their community. But I think my dream is that at some point, getting treatment for your mental health issues is just like going to the gym, something that we all do and accept as a regular part of our life. And we should do the same for our mental health.
Which is very well said. I appreciate both of you so very much. And we do
Thank
have
you
a
for having
long
us.
list of resources on WIBW.com/hearmesee me. We have this podcast that's just allowing people the time and space to share their stories, for people to realize they're not alone. And so I appreciate you, Dr. Walt, for always being a champion for mental health, for you and your family. Armando, for you appreciating Menninger's roots, acknowledging the past, continuing to innovate in the present, and working toward the future. We appreciate having both of you and your colleagues that work every day to help people heal. So thank you, because you are part of spreading that message to everyone out there that we hear you, we see you.